So what we're going to do now is start off with the first discussion point in this program, which is really focusing on the why. So this morning we've already had some indications about the how and why it's important to consider these sorts of things and what the word reset means to different people at different times. We're now going to be focusing on the why. So in terms of this session, we have a couple of different speakers that we're going to be inviting up to participate. And the first presenter today is Associate Professor Gregory Phillips, who has over 25 years of experience in leading change. He is a medical anthropologist and is from the Waiani and Jaru Aboriginal and Australian peoples and comes from Cloncurry and Mount Isa. Gregory, I'm so sorry, my darling. I've known you for such a long time, but this man and his investment in healing work for our peoples has just been profound. So can you please join to this, welcome to the stage, Gregory Phillips. We're also going to be joined now by Professor Maggie Walter, who is Pro-Vice-Chancellor of Aboriginal Research and Leadership. She is a Palawa descending from the northeastern area of Tasmania and is a member of the larger Briggs-Johnson clan. So if you can please invite and welcome up Professor Maggie Walter. We're also inviting up now Mr. Jason Ardler, who is the head for New South Wales Aboriginal Affairs. He has been leading the whole of government and intergovernmental Aboriginal affairs strategy and policy reform across such diverse areas as economic participation, community governance, culture and heritage, community safety, environmental health and service delivery. And he has responsibility for leading the implementation of OCA, the New South Wales Government's community-focused plan for Aboriginal affairs. So can you please just join me now in welcoming up Jason? And we're also joined in this panel by Mr. Scott Monaghan, who is the Chair for Aboriginal Health and Medical Research Council of New South Wales. He is a passionate leader with first-class communication skills and a track record of successful management. He too has had over 20 years worth of senior management experience in Aboriginal community-controlled sector and has been the CEO of Aboriginal Medical Corporations, providing primary health care to the people of Clarence Valley in the north coast of New South Wales. And we're going to be having a wonderful discussion now, focusing on the why of the reset in this agenda. So, Gregory, perhaps to you first. You, as you said, had a long career and history focusing on healing strategies and on change and transformation, both personally but also through systems reform, and you've been focusing on the development of health infrastructure, of research infrastructure, and of a great number of organisational responses to these issues. I'm just wondering, if I asked you the question about why do we need to reset, why is it time now? How could you respond to that?
Thanks, Kerry. And I just want to acknowledge all the experts in the room and people who've been doing the work far longer than I. So just power to everyone that's brought us here today. Look, I think it's not so much about why we need to reset, because I think it's pretty obvious. The statistics aren't changing. Like, what we're doing is insanity. We are developing better Aboriginal policy and better strategy and plopping it into an age-old industrial a health system and a education system and a justice system that was built and designed for industrial age England. So the system is ill-equipped to deal with what we need, and it's ill-equipped to deal with what white people need, just by the way. The system is the problem. So I don't think it's really a question of why. I think that's pretty obvious. It's a question of how. And I think there are three critical things in this regard. The first is values, the second is paradigm, and the third is whose responsibility and which bits do we all take care of. It needs to be said, of course, Aboriginal people are the original scientists and epidemiologists and diplomats and genealogists. We didn't discover science when white people got here. Right? White-collar science is just catching up with ours in lots of ways. So that's the first thing that needs to be said, and that relates to values. Whose values does the system operate on? What we're actually trying to do is retrofit an industrial-aged health system and shove Aboriginal people into it at different points of entry, whether it be strategy, policy, procurement, programs, measurement. That doesn't work. We will only get so far. We will not close the gap if all we do, looking at school attendance from Ian's slide just before, we will not close the gap if all we do is treat young Aboriginal children and their parents as if they're naughty and, you know, they're just truant and they're not turning up to school. So let's offer some scholarships and some, you know, remedial programs to help them. Now, of course, we should do that, but if that's all we do, we're ignoring the fact that our school teachers are not prepared to be culturally capable. They don't understand our learning styles. The investments are not there. School principals leave every 6 months in remote communities. There is a systemic responsibility here that's not being addressed. So let's get real about how we do this. And it goes to the question of values. What we have is an undiagnosed and inherent set of whiteness values in the system that we need to call out. It's not to say that all white people, it's not attacking everyone individually. It's saying the system and the values that we have that are implicit in the system is the problem, right? That system has designed us something that is individual focused, high-end medical treatment, tertiary focused, very expensive, and yet what we know from the Aboriginal experience and from actually the experience all around the world, the best way to improve health and social outcomes is self-determination for any population, right? You fit the values to the population you're trying to work with, rather than try to straitjacket Aboriginal people into a set of white, undiagnosed and unnamed values as if they're normal. So that's the first thing. You know, the task is not to be included in a sick system, but to reform the system itself. And I'll just say prosperity is not a cultural value. We're not going to close the gap if Mr. Scullion or whoever it is that came up with prosperity. Now, Aboriginal people don't like to be poor. Of course, we need economic development, but it's not a cultural value. That's not a good values match. And those kids will turn up to school. They're more likely to turn up to school if there's Aboriginal studies in the curriculum, which is still highly controversial. Governments aren't investing in it. We're not investing in school teachers being able to teach Aboriginal studies. So don't blame the kids for being truant and naughty. Don't blame Aboriginal people for being naughty and not eating their fruit and vegetables and not turning up to their next health appointment. It's not a question of our incapacity to care for our health. If we are so seriously concerned about youth suicide, for example, which we ought to be, how are we measuring police brutality that our youth deal with on a daily basis and harassment? How are we dealing with school curricula that Aboriginal kids can't see themselves in? How are we dealing with triage nurses who can't say the word Aboriginal? Who's measuring that? Aboriginal people are not the problem. Clearly, we have work to do. And if you look close enough, you'll see hundreds and thousands of our people beavering away every day with no pay usually, or very low pay, trying to do that work on our values. And what you'll see is the system and all the infrastructure around, despite good individuals' intent within that system, trying to save us through charity and benevolence. So that's not going to work. The paradigm's all wrong. And it's wrong for white people too. Prevention, comprehensive primary health care works. It's cheaper. Everybody knows that. Every government knows that. If we're really concerned about diabetes and obesity in the community, one of the greatest health and social challenges, you know, in Western civilised, industrialised countries, what I'm really concerned about, I don't think, you know, we need too much more research on blood sugar levels and, you know, blood pressure. I mean, there are some institution workers who do very good work in that area, and power to them. We ought to be concerned with food and drink companies and their political donations to parties. That's the issue. Let's get real about the political economy of Aboriginal health. Let's get real about who's really in charge and why decisions get made and how. A Maori elder, I'll end on this, Turiana Taria, I think I'm saying her name right. She was an MP in the New Zealand Parliament for 20 years, very concerned about child and family services and health services. And I heard her speak at PRIDOC, the Pacific Region Indigenous Doctors Conference a couple of years ago. And she said, you know, what I learnt in those 20 years is in some ways it was a waste of my time. She said, I learnt a lot in the system. We changed some things. Incremental change was good. Power to anybody still in the system doing that work. But at the end of the day, she saw the greatest changes and positive outcomes in health outcomes when they went back to what they're calling Maori family health, right? What our grandmothers against removals are doing, what the Gunda Chamara are doing in terms of turning around out-of-home care. Based on Larissa Brand's self-determination research, they said, right, we as a community are never going to see one of our kids taken away again. And they banded together with no money, no government policy to support them. They fought the department, 24-year-old social workers, well-intentioned, don't understand Aboriginal parenting styles, who are taking kids away. More than twice the number of Aboriginal kids in out-of-home care in New South Wales now than under the apology. Shouldn't be up to grandmothers against removals and the Gunda Chamara alone. We're doing that work. So when we get to the responsibility bit, our communities are doing that work. Yarrabah fixed youth suicide, not through listening to Queensland Health. They fixed that using Aboriginal values, Aboriginal paradigm, and self-determination. We are at a tipping point in state governments around the country. Power to New South Wales for having this sort of talk. New South Wales Facts, I talked to them a couple of months ago. They're in crisis. They know it. They're trying to have a go. Grandmothers against removals are kind of forced them to, but, you know, to their credit, they're responding. Now, when I talked to 200 of their senior leaders, one person in the room said, look, all this talk about power and money, yeah, I get that, I understand that, but it's theoretical, because at the end of the day, I'm the one in charge. The legislation puts me in charge. And boy, there was a lot of things I could have said, right? But what I said is, you know what, you can change the rules. The rules don't work. It's insanity. Victoria's having a go at changing the rules. It's not perfect. They've given all funding and changed the legislation so that VACA are now in charge of out-of-home care. And they've changed the KPIs to make sure that they're Aboriginal values in measurement, what you measure and what's success. Right? So these things are not impossible to change. We're at a tipping point at the state level, I think. The federal government, what I heard this morning, it's light years away. It's in the dark ages. Sorry, to be frank. Prosperity is not a cultural value. If we're serious about closing the gap, the roundtables clearly said racism is a problem. We know from the medical evidence at least 1/3 of Aboriginal people experience racism and discrimination in medical and health settings, most or all of the time. That's self-reported, right? So we know it's a problem. Why isn't it in the targets?
Thank you so much for those really important points. I really appreciate it. And thank you so much for turning it around. Again, that victim-blaming narrative that we're meant to own, you completely disrupt that when you talk about workforces needing to be culturally capable, that they need to be able to practice and facilitate for us experiences that illuminate who we are and really help build us up rather than tear us down. So thank you so much for those comments, Gregory. We'll move along to you now, Maggie, in terms of some of the ideas that you have been working on for decades, and I really think that you are at a pivotal point in providing incredible stewardship and setting precedents, particularly around the ways in which our data is representing who we are, and not only through collection processes, but analysis processes. And some of your incredible work around the data sovereignty we'll be able to hear about more this afternoon in a more full description of what will happen in that space. But for your own experiences, some of the work that's gone on around governance, particularly over data and being able to change the narratives through being able to control that. Could you tell us a little bit about why you think it's important now to reset the agenda?
Absolutely, thank you, Kerry. I'm not a health expert, but I am an Indigenous data expert. I'm a sociologist and a Palawa woman. And it struck me over my many years of looking at the data that we have often, many will say we're the most researched people in the world, but every Indigenous people says that, all with their own stories. We have always had our data collected from us. We are still having our data collected from us, but we are rarely ever deriving any benefit from those data. So data are an asset, they're a resource, they have tangible value. But the benefit to us is being meted out by non-Indigenous people who decide what data are collected, how they're collected, and what analysis and what interpretation are done of those. So what we've got in this country is an Indigenous data paradox. We have both way too much data and way too little data. So if you want to know how much we drink, how much we smoke, how underweight our babies are, how how poor we are, how sick we are, you've got a million spaces to go and find those data. If you want to know how much racism we suffer, if you want to know the links between culture and health, you're in trouble. You're not going to find those data. They don't exist. And this is a real problem. So what we've got is data that at the moment, which I call 5D data. And I always have to look at this because I always remember to get the 5th D. But it's all about our difference, our disparity, our disadvantage, our dysfunction and our deprivation. And the thing is that most non-Indigenous people in Australia do not know any Aboriginal people. What they do know is the 5D statistical Indigene. That's who they think they know and that's who they think we are. And even more damagingly, very often that's the only data we have of ourselves. That's who we think we are. And we're not. So I think Greg's wonderful example there, if you're collecting data around school attendance, there is no point in collecting that one little data point if you don't also collect those other data he was talking about. How many times has the teacher changed? What's the level of interaction between the teacher and the school and the Aboriginal families in that community? Otherwise, you cannot help, but if they are the only variables you put in the model, poor, sick, smoke, drink, don't go to school, the only explanation you can get from that model is that we are the problem. And we're not.
And interestingly too, on the data issue, is the way that it gets represented is mostly through peer-reviewed journal publications, which then form the fundamentals of the evidence that then get used in policy and programmatic responses. And all the success and all of the incredible work that's happening in our communities, around kitchen tables, through networks of sporting associations, between peers, isn't captured and isn't lost and can't actually feed into those processes. So in terms of the governance arrangements over that kind of data and the way that we collect it and the way that we use it, Maggie, what kinds of things can you draw on that will help us do better identification of those things that are working well?
Well, we need actually to be collecting the data. At the moment, we're not in charge. And so governance means decision making. So if we're not making the decisions about what data are collected, when they're collected, which systems they feed into, how they're interpreted and how they're used, then we have no way of influencing that. And so look, I don't want to be on any more advisory groups. I have drawn the line. I'm not doing any more. Done them. Advice is not governance. Consultation is not governance. Decision making is governance. I'm not doing co-design either. It hasn't even started and I'm still not doing it. It's off. We're not doing it. So it's time for us as Aboriginal and Torres Strait Islander peoples to actually be in the decision making place around data governance, and we need Indigenous data sovereignty, which is part of a global movement, because we're not the only people Indigenous people with these problems. If you look at Aotearoa, New Zealand, Canada, the US, exactly the same story about us is told. And I always say, well, either it's something about our condition and the way of the government now that we all are overrepresented in jails and poverty and school attendance, or the British were just unlucky enough to colonise 5 completely different places where the people were naturally crimogenic, naturally lazy, naturally unhealthy, and naturally aversion to school. And so we need a different paradigm around data. And we have to start at the base and build up, with Aboriginal and Torres Strait Islander people being in the decision-making seats.
As you're talking, Maggie, thank you. As you were talking, I was very much reminded about one of the big take-home messages for me. It was one of those poignant statements that Stan made at his speech about a cage looking for a bird. And I actually think that the frameworks upon which we actually collect data, use data, describe ourselves with data is in fact that cage.
Yep.
And they're looking for birds to come and occupy that. So it's good to let the bird out, for sure. Jason, let's move right along to you. You have got not necessarily a health sector experience, but you've really got oversight for all of the social determinants configurations that do lend themselves very well to health and wellbeing. And I'm reminded of the conversation that we had where you went out to Western Sydney to talk with young people about what their hopes, dreams and aspirations were. And I'm just really interested then about all of your different experiences, the incredible role and responsibility that you have on all of the social determinants that do lend themselves very well for health and wellbeing, about some of your views about why we need to reset the agenda in Aboriginal health and some of the ideas that have come through from young people and others in your experiences around this very important question.
Yeah, sure, thank you. So that's right, so I'm not a health expert, nor am I a data expert. Often I actually find myself saying don't let the data get in the way of something that feels like the right thing to do.
Yeah.
And so what I do is reflect on the conversations and the very many conversations that I have with Aboriginal communities right across this state and elsewhere. And so I wanted to reflect really on what for us has now been a 6-year, so we're not calling it a consultation process, we're calling it an ongoing conversation. So in 2001, the New South Wales government established a ministerial task force, and that was really the beginning of a conversation that we've been having for the last 6 or 7 years with Aboriginal communities that was all part of a commitment to resetting, there's that word again, resetting our relationship with Aboriginal communities and to keep on monitoring and evaluating how we're going in terms of the commitments we made to that new relationship. There were a series of conversations that happened early on that led to the development of OCA, which, as you mentioned, Kerry, is our Aboriginal Affairs Plan. And the really strong message, the overwhelmingly strong message that came out of Aboriginal communities at that time, and I think we continues to echo, is about relationship, that the current relationship is just not working for us. We've still got too many things being done to us and at us and not with us, and that we're not seeing tangible improvements in people's lives and on the ground. So what communities called for was a real sense of partnership, genuine partnership where we work together and made decisions together. We shared power, we agreed together what the priorities were, we agreed together how we were going to go about delivering services and programs in communities. But importantly, there was also this sentiment of don't set us up to fail. You need to invest in our ability to come to the table as equal partners and to have these conversations in that sense of partnership. And there was very much a sentiment of invest in our strengths. Invest in our governance, invest in our leadership, invest in our economic capacity, invest in our culture, because these are the things that are going to sustain us and sustain our well-being over the long term. There was a call for localism, local solutions, local outcomes that reflect the diversity in our communities, that we have different histories, we have different cultures, we have different aspirations. And accountability and transparency, of course, were the other key themes that come up time and time again. How much money is being spent? What are we getting for that money? How do we have a say over the priorities? And to pick up the earlier point, what are you measuring? Start measuring what's important to us. Start measuring what we define as success, not the widgets that the government tends to like to focus on. And the other big theme that came out, and I'm really glad that Dan spent so much time talking about this morning, was healing. The need for healing. And communities right across New South Wales told us that if we continued to spend or focus our time on the gaps and the deficits that characterise disadvantage, then we will continue to spend billions of dollars every year on services that aren't sustainable. And we were counselled, I guess you could say, very much to shift our focus away from improving people's experience in the service system to keeping them out of the system in the first place. Very much a shift from fixing people up to lifting people up through investment in social, cultural and economic aspiration. And there's a strong sense that we have to get to the root cause of the disadvantage, not just dealing with the symptoms. And this issue of healing came up time and time again. And so from our perspective, we're really proud that healing, that OCA, our Aboriginal Affairs Plan, is the first one in the country that has healing in it. And that's awesome. It wasn't a straightforward thing for us to achieve that. It challenged decision makers. You know, it's this notion that healing is a journey, not a program. So how do you deal with that? This idea that it's difficult to measure goes again to the issue of data. What are we measuring? And more fundamentally, it went to the question of, well, what is the role of government? If this is going to be in our Aboriginal Affairs Plan, then what are we doing about it? So it wasn't straightforward, but ultimately the inclusion of healing in that plan signified two things, I think. One was acceptance and the other one was commitment. The acceptance, first of all, that past government policies and practices had caused trauma and that this trauma continues to impact on people's lives today. It goes to the decisions we make, it goes to the outcomes that we see, it goes to some of the behaviours that we exhibit. And the commitment was to an ongoing conversation, a conversation where we would sit down and understand trauma, understand healing, and understand how government could support community efforts to heal. And really, we've been spending, quite a bit of time the last couple of years in those conversations with communities at sort of a state level and also at a very localised level, understanding what Aboriginal communities' view of healing is and what the role of government might be. And the sorts of things that people said were, and none of this would be surprising, that healing must be led by Aboriginal people. Healing initiatives had to be led, delivered, designed by Aboriginal people for Aboriginal people. That they couldn't be it wasn't just about another government program or intervention. And in fact, a lot of it was about the notion that traumatised communities have to start being a bit kinder to ourselves and stop continuing to hurt ourselves. The lateral violence issue, of course. There was a strong view that government's role was really about acknowledging and respecting and supporting healing. It was about respecting the relationship with Aboriginal communities, and it was about valuing the process of healing and seeing the legitimacy in healing as a process. There was a call for us to start building it into our policies and practices. There was a call for us to invest in healing outcomes, and there was a call, of course, to build cultural capability in the services that we provide. Very strongly a view that we need to invest in the Aboriginal community-controlled sector and their capacity to get to families in particular before they get to crisis point. Importantly, I think there was this sense that healing is underpinned by self-determination, this idea that we have agency over our own lives, and a connection to culture, identity, language, spirit, and this idea that it's about creating a different future through confidence and pride in who you are and who you want to be. And I think that kind of goes to the point that Stan was making this morning about changing our internal narrative. So it's very clearly linked to other kind of community development areas, education, employment, etc. They're all entwined. What's interesting to me, and again, I don't do data, but I do occasionally read publications that I think are interesting, and it strikes me that what Aboriginal communities were telling us, although they weren't using these words, is that we need to take a healing-centred approach. And I want to distinguish healing-centred from trauma-informed. I think trauma-informed, there are some real positives around trauma-informed. It does acknowledge the circumstances that create, or that harm does create, mental, physical and emotional health problems, and it does try to deal with the whole. But I think it's fundamentally still a deficit-based approach because it still focuses on the trauma. It also, the trauma-informed approach also doesn't reflect, I think, the fact that trauma can often be a collective experience, not just an individual experience. And I think about kids in neighbourhoods where there's lots of violence. More directly related to my work, I think about stolen generation survivors, and having had the privilege of sitting through 40 or 50 settlement conferences with stolen generation survivors and hearing their stories and the consistency in the life experiences that those survivors have had after they left their institutions. And the conversations they have are always about their collective trauma, and they want to heal their collective trauma. And so I think that's, it's important to understand that trauma-informed approaches don't really get to the root cause, and they don't take that really aspirational approach that communities called for. Whereas I think the healing-centred approach does. And the healing-centred approach very much goes to the issue of culture, and this understanding that culture and identity create a sense of community, they create a sense of shared experience, they create a sense of shared identity, and those are the things that drive aspiration often. Again, it's, Jeff McMullen and I have been having a lot of conversations recently about, Stan called it the narrative. We talk about the public discourse and the fact that the media in particular tries to paint all of us as being characterised by the most traumatised in our families and our communities. We're all the same, and we're all at the bottom rung. So this idea that we aren't the sum of the trauma that we've experienced, that we have aspiration, and they're the things that we need to start focusing on. So when I go out and talk to kids, young people I should say, whether it's in the context of the healing conversations we've been having, whether it's in the context of the work we're doing in Western Sydney to develop the Aboriginal Centre of Excellence that we're working on, what we hear often is we don't want to be constrained by the trauma of the past. We want to put things like lateral violence and those things behind us. We don't want to carry that baggage forward. And the other thing that they tell us all the time is don't constrain our aspiration. So we went into building this Centre of Excellence thinking there's all this investment going on in Western Sydney. We need to find a way to transition kids out of school into those opportunities. And they're saying to us, yeah, great. We're seeing beyond Western Sydney, it's the world for us, and if you're going to create a Centre of Excellence, you better make sure it's truly excellent. So we're on notice because they're not caught up. Certainly these kids aren't caught up in the trauma of the past. They want to move beyond it and way beyond it. They're into the stratosphere, really. So yes, we need to reset. We need to reset the relationship. We need to reset our focus, and we certainly need to reset the narrative, I think. But what I find really interesting in this is the communities clearly have the answers. They're not sitting down doing academic research. They just know intuitively we need to do this stuff. The difficulty is, the challenge is, of course, they don't always have the confidence, the capability or the opportunity to do something about it, and that's where they need the support of all of us, whether it's government or the Aboriginal service sector, to give them that lift up.
And that lift up comes often from just having some low-level experiences of mastery that then transform into confidence, which allows and enables people to take the next step. And that's certainly something that Scott's work has been intriguing to me for years about, because he can follow through an individual on their journeys through all kinds of different health service systems, and what the promise of the work that's happening within the region that he's currently working at is to make sure that those people have that wonderful experience all the way through their health journey. And I'm just wondering then, Scott, if you could talk to us a little bit about why you think we need to reset the agenda and the mechanisms that you're putting in place at those regions to make sure that that patient journey is something that people can really have a good experience of.
Yeah, Kerry, look, Minister Hazard alluded to something earlier in his speech when he spoke about dental in Casino. And to give you a brief story about what's happened in Casino, in 2012 they received federal government funding for a new building because they'd rented a building for about 20 plus years that was substandard, tiny. So they went down, they had a scoping study done which included dental and auxiliary services, allied health, for a purpose-fit building. There was a purchase of a block of land from the local council, and we'll forever be thankful for them, for the journey we had with them, is that we purchased the block of land only to be informed that it was riddled with asbestos, which it sounds like a journey of tragedy to start with, but it ends up quite well. riddled with asbestos, and then it cost about $700,000 to have that removed. That came out of the existing budget. Then we were informed by council that we had to provide parking, not at our door, but somewhere down the street. That was $400,000. So we're close $1 million under budget to start with. Our partnership agreement with the Area Health Service stems back some 10 to 12 years. And for us, it's a workable and a meaningful partnership and an outcomes-based partnership. It's not just a talk fest where we get around the table and have a discussion for the sake of having a discussion. The CE is committed to turning up, and in those early days, it was an Area Health Service and the AMSs in the sector. And then we then invited in the Medicare Local, transition to Primary Health Network. So in our wisdom, given that the local health districts were then in charge of, or had the opportunity to chase capital funding for Aboriginal health, the Area Health Service supported us in that process. They put an application to New South Wales Health, and the service was then funded $900,000 to go forward. The Commonwealth then came back to us and said, well, we don't do dental, even though it was in the scoping study and they accepted it. Dental's not accepted. So I think at that point we were happy to go forward with the service that we had, bearing in mind that we were funded for a 2-day-a-week service in the existing building. We then went back to the partnership again and said, look, we need to have a rethink here. Dental's important. We've got kids that need to have their regular checkups, but we've also got adults that need more extensive work. So through the partnership, the Area Health Service then agreed to have a dental service within our own infrastructure, within our own building. The shortfall on our sector was that we didn't have the money to pay for it. So Area Health Service then went back to, I don't think they went back to New South Wales Health, but went back to their own kitty and funded, I think, a $700,000 refit of our existing building to have a dental service. We've now got a four-day-a-week dental service with 2 chair-sided assistants, an oral hygienist and a dentist. So the journey that service had in getting those services in, plus pre-existing services like a diabetes assessment and complication team that the Area Health Service provides. We work in partnership with the Area Health Service to identify people with early onset or early stages of end-phase renal failure, something like Mr. White had spoken about today.
Yes.
So, and that work's been going on, I think, for 13 years in Casino. So there's a whole heap of good work that's going on in Casino, and living in the north and seeing that every day, you come to think that that's a normal process that happens everywhere. I soon found out that that's more of the exception in the sector by being on a couple of state and national boards. And I think for me today is about having that discussion about how do we reset and get that same relationship across Area Health Service footprints, primary health networks, and local AMSs, because what happens there is there's some small splatterings throughout the state of good work that happens, but largely the patient journey from our service to the hospital is somewhat removed, and in other areas, and the GPs have no idea when someone's in the hospital, apart from a discharge summary, if they're lucky enough to get that. Ours is a work in progress. It's good, but we hope to have be the exemplar in providing services to Aboriginal people in our sector. We're heavily involved in integrated care, meaning that if someone is in hospital, there's a notification sent to our service, and the doctors are aware of why they're in hospital and how long they're in hospital. I think in some instances, we're not focusing on the patient journey. We're focusing on a siloed approach that is simply either funding the AMS, funding the Area Health Service, or funding coming through the primary health network. One of the issues that has arisen now that PHNs have been funded for Aboriginal health in a whole raft of areas, and one in particular being ITC, or the old care coordination and supplementary services dollars, is that there's almost a bounty on the head of Aboriginal people that are referred through that process, meaning if if we refer someone to a specialist,
Yeah.
18 months ago or 24 months ago, most of the specialists were quite philanthropic and they bulk billed. Now with the advent of this money that's come around to assist simply in getting people to services or meeting the gap between Medicare, specialists have seen the opportunity to bulk full costs to some of our patients, and that means it's a cost back to the service. And in some instances, it's as high as $400 or $1,200 per consultation, when previously it was a bulk billed fee. That's some of the work that we still have to do in the North Coast, is to try and alleviate that black market in Aboriginal health, I suppose, the dollar value, and I think that's pretty much across the footprint that there's a real industry in Aboriginal health outside of fixing people. It's a dollar value, but the issue of partnerships or meaningful partnerships, I think, needs to be explored across the area health service footprints, the AMS land as well, and primary health networks, and coming together and concentrating on that patient journey so that there's not an AMS in every town in New South Wales, even though New South Wales has the highest density of AMSs in Australia. So many of those people access a private clinic. So we need to think how, as a sector, we provide services to Aboriginal people where there's not a medical service in those towns. Because many of these people are travelling to, or if you live in Western New South Wales, 3 to 500 k's to get to an AMS to get a service. I believe the services that are provided in AMSs are as good as what you can get in a care sense, so that you can go in and you can get your teeth, you can get your eyes done, you can see the podiatrist, you can see the exercise physiologist, dietitian, you name it. There's not many services that we don't do. But I think there needs to be more access to those services in areas where there's not an AMS, and the area health service and primary health network play a key role in providing some of those services for that seamless journey for a patient to get the healthcare that we expect these days in New South Wales, in Australia.
It's so important. I was talking outside with a colleague who focuses a lot on housing and housing affordability and social housing and access to secure housing, and that is one of the fundamentals for achieving health and wellbeing. I'm just looking at both you and Jason sitting here together. You've been out doing this work across different jurisdictions. You're really focusing on place-based approaches and collective impact. How much is there a chance for the health sector to work with the housing sector, for example, and do that kind of sharing across of what kinds of things are going to facilitate this reset of a relationship so that people in their own homes can experience health and wellbeing and come to the service delivery sector when they require it? So basically transitioning out of health into our homes, basically.
Look, I think there's a great need to address the social determinants, because whilst ever there's overcrowding, or whilst ever there's people couch surfing, there's always, AMSs will always have a job, and people will always be presenting with, first off, the common ailments is school sores or those sort of things that just progress when people don't have a good opportunity for housing. I mean, I think the Aboriginal sector is almost in crisis in housing, particularly on the North Coast. And I'm sure there's people from Western New South Wales here in the room, but it seems that most of Western New South Wales are on the east coast of Australia at the moment. We've got the highest density of Aboriginal people in New South Wales, and it's a great place to live. The problem is the housing and infrastructure on the east coast is not keeping up with the demand at the moment. So that means that you have 2 and 3 families that are living in one particular house that's really only built for half a family, really. It's not built for 8 to 10 people.
And Jason, have you been able to facilitate some of these sorts of discussions at a place-based approach to resetting the agenda for you?
Yeah, to some extent. I mean, it is difficult. I would say that. I mean, one of the things that we've learned through implementing one of our programs, local decision making, is understanding the extent to which we do run in our silos, in our lanes, and trying to get people to come together around to find solutions to things. People my experience would be that public servants and others on the ground hear the rhetoric of innovation and collaboration and all of that, but they don't necessarily trust it. And they're not sure that if they get it wrong, they're not going to be held to account for getting it wrong, even if they've had a red-hot crack. Having said that, where we have seen some success, there's a couple of areas, and they're quite different experiences. One was on the far south coast in Eden, some work we did there with the Eden Land Council. And more recently, and perhaps more complex, is the work we've been doing in Barraville of late. The Eden example was one where there had been a 20-year conflict between essentially the Aboriginal Land Council down there and government land management agencies, particularly national parks and state forests, over some outcomes that they believed that they were dudded on coming out of regional forest agreements back in the late 90s. And they had been regularly raising this as an issue. And so we tried to facilitate bringing relevant agencies together to kind of work through this issue, because it was Crown lands, it was national parks, it was state forests, it was local government, to some extent it was the federal government and a number of others. And what we found was that while we were talking about the conflict and the problem that had to be fixed, we couldn't get investment. We could get people to the table, but they weren't really buying in a meaningful way. At one point, the Land Council, to their credit, put their community land and business plan on the table, which went entirely to their aspirations.
Yeah.
This is what we want to achieve. And the conversation turned 180 degrees almost in a minute. All of a sudden there was, we can see how we can contribute to that, as opposed to we're having to defend what we do because it's what we do. Yeah. And I think, a little bit similar in Barraville, it was really hard, but we did the work in Barraville because we'd had this parliamentary inquiry which landed on a number of recommendations, and there was a real concern that even if we implemented those recommendations to the best of our ability, it wasn't going to add up to anything. And so again, it was a process of sitting down with the community around their governance and saying, what are your aspirations? Yep. And then how do we facilitate that? Now, there were all sorts of issues around accountability and we had to have a departmental secretary in charge, it felt like, to get sort of cut through on things. But ultimately, we were able to redevelop the medical centre there. We were able to get transport routes changed. Yes. We were able to get commitments to building a skate park so the kids had something to do. And so there was a far more holistic, community-focused approach that came out of that. So it is possible, but it's bloody hard work, I've got to say.
One of the things that might help it, and this is very much the Victorian experience at the moment, but I'd love for you both to comment on it, is the process of treaty that the state government have now negotiated with a whole range of First Nations people in Victoria, and there seems to be a lot more state government action in this particular set of negotiations across Northern Territory. They're starting to consider it and that kind of thing. Gregory, you have been part of some of those conversations and consultation processes in the Victorian context. And just coming back to your points around the experiences of discrimination and the ways in which we narrate ourselves, do you think that could be transformed with this political overlay of a treaty process for having new kinds of conversations? Is that part of a reset agenda that might actually leverage some good results for us?
Yes, there's a very common policy red herring that's thrown out, that when you talk about things like sovereignty and self-determination and sharing power and money, that it's all just too political and it's not practical enough. Well, let me demonstrate to you why it's very practical. PHNs was raised before, that's a very good example. For some reason, we have thought that giving PHNs money for Aboriginal health and then getting them to decide who's the best Aboriginal health service provider, we've thought that's a good idea. PHNs who have no cultural capability, no local relevance. But it's a really interesting example of how self-determination can play out, or should, or doesn't, because I actually think the system and PHNs know very well that comprehensive primary health care is where it's at. I think they know that's the model that works. And they want PHNs to control it. That's what I think's going on. PHNs want our model. It's not good enough. Now, individual people in those PHNs or individual PHNs may not think that, But that's how we've set up the policy power balance. That's rubbish. Now, in Victoria, when Corin Ballajak, the new Aboriginal health strategy, was written, just launched just last year, and of course the treaty was only passed last night in the Victorian Parliament, not the treaty, but the process for the treaty and setting up an Aboriginal representative body to negotiate what will be in a treaty. The Health Department, to their credit, said, well, we're not going to wait for that, we're going to have a go at what this means in the health space now, because we know that self-determination is important in health and social outcomes. And, you know, at first, in Premier and Cabinet, there was somebody whose job title was called Manager of Self-Determination. And to their credit, they listened when we politely pointed out that was a bit silly. So you see, the policy infrastructure and the system is set up to think that it must own the new buzzword and the new thing. They thought self-determination was just a new policy for the government to roll out. And that's clearly not what it is. For policymakers and systems, self-determination means getting out of the way. It means shutting up for 5 seconds, and it means handing over a bit of power and money and having a go at trust. That's what it means. And it's actually not that hard. It doesn't mean that there's no role for government. There are very important roles for government to play. It just means how you measure, what you measure, who makes the decisions, what programs and models and paradigms, what policies. All of those things are not presumed, they are negotiated. It's what Maggie said, we're sick of being advisory. That's dark ages rubbish. It has to be an equally negotiated arrangement between the people and the government. The government have very important roles to play. The government's role is in cultural safety, cultural competency, cultural capability, whatever you call it, which is not culture. Cultural safety is a euphemism for racism, meaning a system that doesn't work. That's the role of government, to fix that. We're sick of trying to deal with racism, right? And you hand over Aboriginal health to Aboriginal people on Aboriginal paradigms and you share. It's not about who's in charge and one's got a winner and loser. It's about sharing.
Absolutely. And Maggie, just to that point though, the ideas around treaty and the aspirations and intent of that, whether it's at a regional level where you get the chance to negotiate housing outcomes for people, or whether you get the chance to talk to young people who have aspirations of going and working in New York, or whether you want a health service system that's not based or facilitates discrimination. What does that mean for us in terms of data sovereignty and autonomy and the narrative that we can give ourselves?
Well, look, it's all dependent on data. You cannot have treaty without data. The Uluru Statement from the Heart requires data for its implementation.
Yep.
And it's data that we don't currently have and is not being collected and is not being envisaged. And you know, you can't run, I mean, the treaty in Victoria, how many Yorta people are there? Well, who knows? No data are collected. You know, this is some of this, we've got this really basic model where we have just, talking to dark ages, our data is stuck in the 1970s, and even the analysis is just this tiny little bivariate, you know, run by aggregates. It's got so many limitations, and to move forward, we need data for nation rebuilding. And that's what treaty and the Uluru Statement of the Heart are all about.
Yep.
And we need to be in charge to actually say what those data are, and we need that data at the national, the community, and all levels. We just need to. Yeah, it's very frustrating when I see what comes out in the AIHW report every 2 years and elsewhere. It's driving me insane.
Can I just say something about healing too? And healing is often presented in public policy debates as if it's sort of touchy-feely and just all about trauma or recovering from intergenerational trauma. And we talk about past mistreatment. Sorry, the mistreatment's happening now as well. It's very uncomfortable for us in the health space in particular, but in Aboriginal affairs. We have to separate intent from effect. most of us don't intend to wake up in the morning and be racist or to have negative views or values that are off skew or off key. But certainly the effect of those behaviours is there for us to see in the statistics, right? Even though it's the mad, bad and sad stats, that's what that's saying. So we need to... What Uluru said is it's not only Aboriginal people that need healing. The Uluru Statement from the Heart said Aboriginal people want a voice. Now, I don't agree that it should only be advisory to Parliament, but whatever form it takes, we need a voice. We need a treaty because we need a lasting arrangement and agreement between peoples as a nation. And we need... what's the last one? I should know. Talking too much. Voice, treaty, and... Come on, test. Huh? Truth-telling. That's the one.
That's the one.
If we don't tell the truth, then of course we just still operate on the normalised values of white is right and blackfellas just fit in somehow.
Yeah.
Yeah? So the point is that whitefellas need healing too.
Yeah.
We've got a system and a history that affects us all. And that history of colonisation affects whitefellas without them meaning it or knowing it, so that they think their way of thinking and doing and science is normal and everyone else has to fit in. Now, why is that important? It's not just important for Aboriginal people to fix that. It's important for the nation. This is why we don't have good foreign policy at the moment. This is why we don't have good climate change policy, because we refuse to acknowledge that Aboriginal people and values and knowledge systems for 60,000 years might tell us something about bushfires. We refuse to admit. We don't know how to do racism, talk about it. We've got very unsophisticated public conversation about this. We're scared of it. We're scared of our feelings about guilt and shame, about colonisation and genocide. So we just deny it. But that means when China, existential threat, comes along, we're still trying to suck up to America, God help us with who's in charge, and we're still trying to tie ourselves to England, but we know we're sort of not going to be there forever, but we're not sure, and and we don't know how to deal with China because we don't want to be racist, but we do want to protect our land and farms, and we're not. That's why dealing with values and truth is critical, because we being Aboriginal and non-Aboriginal people, are not going to survive in this country if we don't figure out how to share knowledge systems and have a more sophisticated understanding of race. Unless we can do that, we will still be shackled with industrial age systems and knowledges and thinking, and there'll be more and more bushfires and floods and droughts.
My goodness. Look, on that very ominous note to move from this stage, but back into the audience there. We have got so many leaders, so many capable people, so many people who are doing this on a day-to-day basis around your tables. What I think might be worthwhile doing now is just a 5-minute slam session with everyone there at your tables, just talking through why it is that we need to reset the agenda. And we'll just do that for 5 minutes, maybe hear back from about 3 tables, but it might be worthwhile then giving it to the visual artist up the end of the room to be able to then map out what it is that all of your tables are able to describe.